Hi, everyone. Good afternoon. In the interest of time, I am going to get started. Thank you so much for joining me today. Today, we're just going to cover the topic of transitioning your research and your academic pursuits into health policy change. So, I know a lot of us are day to day advocates for our patients, but how can we really translate the academic work that we're doing into impactful policy changes? So, as you guys see, there are many names on this presentation, but have the pleasure of being with you today. I have no disclosures. So, this presentation really wants us to go through four key objectives, and that's really to analyze the intersection of academic research and health policy, as well as evaluate the roles of academic physicians like yourself in shaping health policy, introduce a framework in order to guide us as academic professionals into this transition of policy advocacy, as well as evaluate some practical opportunities for us as physicians to get involved, but using informed transitions from people who are already doing this work, and then reflect on the lessons that we've learned from tangible examples and guide actionable steps in order to integrate health policy change into academic work. Again, my name is Tanisha Beckford. I am currently faculty at Mass General Brigham at Brigham and Women's Hospital. Alongside me here to the right are my teammates who helped me put this presentation together, but unfortunately they could not be here today. So we're going to start off with, setting the foundation of what we mean by health policy. I think a lot of times we have different definitions for advocacy, and I wanted to highlight the World Health Organization definition for health policy. And it states that it's the decisions, plans, and actions in order to achieve specific healthcare goals within society. I do want to point out that this definition is a very broad definition still. It really does not hone in on the complexity of health policy when it comes to managing these decisions, plans, and actions. It also doesn't really talk about how we as clinicians have to protect populations, how we use these initiatives to strengthen health systems, and how we use it to really implement prevention and care pathways. So despite this definition giving us a broad scope, there are things that really do not speak to the depth of what that really means. So why does it matter? Well, emergency medicine physicians like yourself make up about 4% of physicians within the nation, but yet we see about 2/3 of the populations that are uninsured and that use our emergency medicine for safety net care, right? So we serve as a safety net within these healthcare systems. And we often see the downstream effects as a result of that. So whether it is the opioid crisis, I know that we had some addiction specialists here in the room prior, whether it be dealing with the undomiciled populations, mental health, and again, people with gaps in their insurance coverage. So even if you're not that into policy, I am sorry, but policy does impact you, right? So when we think about who has access to care, EMTALA, in this political landscape, we're also talking about Medicaid expansion. What does that mean for reimbursements in the emergency department? We can also consider what resources are available. Several years ago, we didn't have a EHR system in hospitals, right? So policy was what impacted that. Staffing, reimbursements. And then also, we need to look at how is care delivered? Is it through telehealth? After COVID, there was a huge implementation of telehealth services. And then when we think about mental health, we think about the introduction of crisis stabilization units. So, in order to implement policy, we should think about the frameworks, but also think about the roles that we can play as academic emergency physicians in policy. So we should be conducting our regular policy relevant interest in research, as we've already been doing. But we should also consider serving as advisors to policymakers, leading advocacy initiatives in professional organizations, because overall this brings a benefit of engagement through enhancing patient care, and as well as leading to systemic changes. We can influence these policies to reflect clinical realities, right? Keeping up to the day-to-day realities. Often we know that sometimes our research can take years to publish and bring and implement that change. So policy making is a great way to reflect the clinical realities of what's happening now in our EDs, as well as it's an opportunity for professional development and leadership opportunities, both for people who are much younger in their careers, as well as people who have been doing this work for a very long time. Some of the barriers to engagement, as many of us may presume, is the time constraints, right? Physicians today are called to be experts in policy, experts in clinical medicine, experts in research. So we have a lot to carry on our hands. We also consider barriers of the lack of formal training, right? Everyone's training is a little bit different when it comes to advocacy, particularly political advocacy, and then institutional support. How can we advocate for institutions to back experts in order to have them go to policymakers and make this count? So I want to introduce to you the advocacy planning framework. And there are three key elements in this framework that really focus on ways into the process, the messenger, as well as the message and the activities. So when we think about ways into this process, we have to consider the policymakers. Who are they? How can we get involved into policy? The messenger, who is best fit in order to send this message? Who are our stakeholders in community, in institutions, or in government, whether that be local, state, or federal? And then the message. How do we want to convey this message? What are the next steps? What are the timelines to conveying this message? And as you see here, when all three circles intersect, we focus on our core strategic focus for what the verbiage says is your campaign, but really it's for your initiative, right? A lot of this policy wording can seem intimidating because it's not what we're used to, but really it's your initiative, it's your focus, and it's the change that you want to implement. Now, I like to call that small core circle your window of opportunity. In other frameworks, it is actually identified as the perfect window of opportunity where all three things intersect. As you can imagine, there are multiple frameworks, but I think this simplifies it very much so that we can ask some key questions. So one, we talked about ways into the process, and that's really acknowledging our policy environment. I would say that each of us come from multiple different states across the nation, right? And your policy environment may vary from the person sitting next to you, so keep that in mind. And the key questions that we need to ask are, what are the current policy landscapes, right, surrounding the issue of interest, whether that be the opioid crisis, mental health crisis? Who are the decision makers within your state, within your city? And then, are there existing policies? A lot of times we want to bring about change, we want to write a new paper, but we always do a literature review. So same concept applies to policy. What are the existing policies and where are the gaps that we can fill? Our second pillar for the advocacy framework is really identifying advocacy strategies. We should think about our objectives, right? So what are our clear goals? I want to achieve X by X date. What is the messaging? Messaging for policy looks very different than messaging for your research. We'll learn in some anecdotal interviews how we can simplify our research in order to make it palatable. What are the tactics that we can use? Should we join political campaigns? Should we engage in meetings with policymakers? And then establish a real-time metric. And then the third pillar is figuring out the organizational capacity. This is the messenger, right? What resources does your institution have in order to get this work done for political advocacy? Who are your allies? Who may give you some pushback, right? The goal of advocacy is not that everyone will agree with you. You will receive some pushback. So you have to think about who are your partners, who are your allies in this work, and how can you make this work sustainable as well as adaptable. So we zoomed into that core strategic focus that we talked about, our window of opportunity. And when we think about this window of opportunity, it has to keep up with our real day-to-day struggles and challenges. So we think about what are the current obstacles that we need to change, and what are the policies that are blocking that from happening right now? How can we leverage our time, our expertise in order to bring use to this topic? As well as, is this feasible? Can I make this happen? Are institutional values aligned with what I am trying to make happen? So here kind of just sums up everything that we talked about, right? Our three pillars of looking into the policy environment. That's the ways into the process, the messenger, what is our organizational capacity, who are our key stakeholders, and the message. What is our advocacy plan for this work? How do we want to get it done? So that eventually we can move into this orange circle, which is focus on our key initiative to bring these current obstacles to change, leverage our time, and then focus on the feasibility of our advocacy objective. And really, when we think about leveraging our expertise, this is the catalyst that has us move forward and projecting this work, right? We figure out who's going to support us in this work, what is it that we know that can add to this work, and then it has the ability to propel and move that system forward. So overall, we should really try to develop a structured approach to influence policy. The framework helps you to categorize each portion of this. However, we should also summarize that in 4 key steps. Define the issue. Identify that specific policy problem that you are trying to impact. And then set SMART goals, right? SMART meaning specific, measurable, achievable, relevant, and timed objectives. Map your stakeholders. Do a stakeholder analysis, take a step back. Who are my community leaders? Who are my political leaders? Who are my institutional leaders? And then leverage the research or the academic expertise that you all have in this room in order to build your case for advocacy. So we did some preliminary anecdotal interviews in order to get a hold of what is already currently happening in this landscape. On the screen here, we have 4 interviewees that we spoke to. Some of you guys may be familiar with these policy leaders. Emily Cleveland, she is assistant professor at Boston Medical Center, but she is also the interim VP for equitable systems, as well as the director for social justice education and implementation for the AMA. That is her policy hat. We have Scott Weiner at Mass General Brigham, who focuses on opioid use. We have Joseph Kopp, who is the medical director that focuses on the urgent care services at MGB. And then we have Rob Gore, who is the clinical assistant professor at Kings County Hospital, as well as the founder for Violence Against Kings Initiative. So as you can see, they all have a very diverse lens into their policy work. Now, from these anecdotal interviews, we were able to gather 4 key themes. Key theme number 1 is that storytelling is your superpower. Some quotes include, data doesn't move people, stories do. Policymakers care about personal struggles. Individual stories are how their lives affect our lives. And then the stories become qualitative research, and they are the ones that impact policy, right? So here, these themes of storytelling really feeds into the message and activities and the messenger framework. if we think about our advocacy framework before, we need to tell our personal stories, that is the message, and we need to share our patients' personal stories. Sometimes we can even advocate for our patients to be the messenger of their own stories. Theme number 2 that came about from our anecdotal interviews is that your unique experience is valuable, not your policy degree. So, a lot of this really comes from our day-to-day interactions with patients. It's all trial by trying, says Dr. Joseph Kopp. Just be involved. The best training is on the ground, and everyone in this room has that training. Don't overcomplicate it, right? Policy is made by people just like you and me, right? Just like from the communities that we're from. And just start, right? Now is the time to start. It doesn't have to be perfect. You can refine it over time. And just like a business, if any of you guys are business owners or into business, it evolves over time. It gets better over time. And this theme fits the organizational capacity and feasible objective from our advocacy framework. Our third theme is start locally. Policy can often seem intimidating because we think about what's happening on a federal landscape or something over our heads, but really start locally. Start at your own institutions, and then be strategic with the policy change. So what policy would make this irrelevant or relevant, really, you can ask? What's our side of the story? How is this impacting our opportunity to really give the best patient care that we can? Have lobbyists guide you through this process, who knows how to do this daily work and who can help you give your testimony. And Rob Gore says, we force the city's hand. Talk to the city, tell them what you need. How will they know what's impacting your patients or impacting you as providers if you don't speak up or say anything? And this theme fits in our ways into the process. This is how we're identifying our political environment, by asking these policy questions from our clinical care interactions, as well as our academic work and research. And then the last theme really focuses on research being power, right? Research being the nidus for change, but when it's simple. Messaging is key, particularly when we're speaking to policymakers and also when we're speaking to community. You don't want communities to get lost in the message, right? So my favorite papers had a very simple message, is what Scott Weiner said when he was talking about the impact of naloxone treatment for patients with opioid addiction. We use data to change how our systems are set up. Right? So the data backs up our stories, and both together creates this powerful change. Show people a problem and then come up with a solution. We use our data to show the problem. We use our patient stories to advocate for the solution. And Rob Gore says, in speaking to educators and policymakers, I needed language to explain what I knew through a clinical lens. And this last theme really fits the framework of leverage. Who are our stakeholders in this work? So I want to make sure that you leave here today with some practical strategies to leave this room and be policy advocates for your patients, if you find the time. So how do we identify policy opportunities? So we can start by tracking legislative or regulatory changes that are happening locally within our state, as well as using organizations like ACEP or any emergency medicine association or any governmental health agency. You can take your pick, CDC, things that you are passionate about and already doing this work. Stay current on emergency medicine policy, right? ED overcrowding. is something that we all face when we think about our boarding patient, that has been waiting for a psychiatric bed for several hours. EMS funding. If these are your passions, think about what's happening currently in that landscape. Then recognize the gaps in clinical care, right? What are the recurring themes and the recurring issues? As we mentioned, mental health, right? Crisis that is facing all of our emergency departments. And then sometimes drug shortages. Some of us were impacted by the shortage of IV fluids. What does that mean for us from a political landscape? And then leverage existing networks. As mentioned before, ACEP has their own advocacy committee or state EM coalitions. So each state has their own statewide ACEP that you can get involved in and figure out what people are doing as a collective. You don't have to do this work alone. Strategies to engage effectively with policymakers include building relationships. Just like being here at this conference, networking matters. Build those relationships early, not when a crisis hits, right? Not when we have COVID-19, not when we are looking for a patient bed for our mental health patients that is waiting in the emergency department. Build those relationships early, and that way we can identify our key legislators on health committees to help make this work happen. And finally, the strategies to communicating research for policy impact. So think about that research paper that you have written, that you have contributed to, and replace all that jargon with clear takeaways. Write short policy briefs, one page to 2-page policy briefs. We all know when a patient already has their disposition, the first thing you say is, give me that one-liner, right? So just like our policymakers, we need to figure out a way to make this message stick. Partner with advocacy groups. Advocacy groups have been doing this work for a very long time. Though not clinically, they've been out in community pushing for policy change. So identify those partners because they will be your key stakeholders in this work, and share your research with them. Help break down that research so that they can also use the tools of data to bring this to policymakers as well. And lastly, consider testifying at hearings. Volunteer as an expert witness when bills that align with your interest come up within your expertise. This is a perfect opportunity to share those patient stories that cause you to advocate for this change. So I want to boil all those practical strategies down into some actionable steps for you. And that is, join a hospital committee in order to push forth these policies. Schedule a meeting with your local legislators for advocacy, or try to join an advocacy group. Be a general member of this advocacy group so that you can just get a sense of what is currently happening within your state or within your institution. And as you do that, try to track policy issues as they come about, right? Log the relevant bills that may come up. If you're watching the news, what are some of the regulatory processes that they're talking about? What are some of the funding opportunities that come about at every level? Keep your own personal log of this. And then lastly, in order to integrate policy advocacy and academic work, think about publishing your research in dual audience journals, right? That target both the clinical but also political journals as well. So I just want to wrap up with some key takeaways today. And we discussed how using the advocacy planning framework as emergency medicine physicians can help us use our academic work to really bring forth policy change by acknowledging the ways into the process. So that is our political environment. Who is the messenger, right? Is it our patient? Will it be us? Will it be someone in the community? As well as the message that we're trying to convey and the activities that we can take to do so. We learned 4 themes from our anecdotal interviews. That storytelling is your superpower. Narratives drive change, not statistics. I love this quote from Rob Gore that says, "Nobody remembers facts, but they remember the stories." And this holds true, particularly when talking to policymakers. Our second theme is that you don't need a policy degree to impact policy. Though formal training should be something that we can consider, we can affirm that we learn these things by doing. Our third theme was start locally, as well as be strategic. Use our partnerships and our collaborations from different sectors to our advantage. And then simplify your research in order to unlock the power of clarity, right? Support research-based messaging that is direct, personal, and tied to causality. Again, a wonderful quote from Dr. Rob Gore says, "You have to make the argument simple and valid." And to sum up our practical strategies for policy advocacy, we want to identify policy opportunities by tracking regulatory changes, recognizing the gaps in clinical care, and then leveraging our existing networks. We want to focus on engaging policymakers by building those relationships early. So hopefully that inspires you guys to look up who are your local legislators in your state. If you are interested in advocating for some type of policy change, who is doing this work in community, as well as communicating research for policy impact in a translatable, simple way, and partnering with advocacy organizations so that you know the language that is being used in this landscape, particularly when it comes to community. And consider sharing your patient personal stories in order to testify for bills within your local state house. So this quote really sums up, I think, the essence of today's talk. And it says the most powerful driver of policy change is people. Not only those with the ability to change policy, but also those who can influence it by challenging the governing values and interests and communicating a compelling, evidence-based case for change. And those people today are you in this room. Here are some of the resources, emergency medicine resources specifically that you can use if you're looking for ways to get more involved in advocacy. We have the Emergency Medicine Resident Association Advocacy Handbook for the residents in the room. Also very good for the faculty in the room as well. And we have the Leadership and Advocacy Conference that gives you the opportunity to partner with your local colleagues as well as your national colleagues to advocate for pressing issues that all emergency medicine physicians face. And that is it. Thank you. I would like to give a special thanks to Dr. Alden Landry. And thank you guys for joining me today. If you have any questions, I'm definitely open to more conversation. Thank you.